motivated you to come up with this laboratory?
My main motivation to come up with this idea was first, we were the third batch to be graduated from the Faculty of Health Sciences, University of Ghana, 2007. After one has acquired a lot of knowledge, there was the need to have some space where you start practicing, you start exercising the technical know-how which you have acquired from school. And it is thanks to this small focus that when we started practicing, I was able to sponsor myself to do a master's and subsequently a PhD. And with this mindset, I think I will challenge all Cameroonians to be forward thinking like this, so that upon graduating from school, you should be able to create a job for yourself, because we all cannot only rely on the government. We should be job creators, not job seekers.
Why Kumba?
Okay, thank you so much. I think I visited Kumba for the first time in 2008 or so. And when I came, I looked at the strategic location of Kumba. Kumba happens to be a road junction town. It links West Africa and East Africa. You can see this road passing from here, you see this road passing from here, Mundunda, the camp in Nigeria. So it is a very strategic location. Kumba is a road junction town, not only in Cameroon, for the whole of Africa, linking West and East Africa. Nigeria is just our neighbor next door, and Nigeria is the economic giant of Africa. And look at the strategic location of Kumba, next door to Nigeria. Whether you're passing through Eko, whether you're passing through Ekolotiti or Moneba, you all land in Nigeria. So Kumba is at the exit of this economic giant Nigeria, and that links to the west of that links us to the rest of Africa.
And when we talk about this, persons might like to know, what do you do? Who are you? What we've just been talking about, we are. What do you do?
Thank you so much to the veteran Jomo Kevin. Once more, it's an honor having you for this particular interview. What we actually do here in the heart of Kumba, this is Ideal Medical Laboratory. This is a referral lab, and it is a very confidential lab where all the big personalities, people who don't want to be seen in the corridors of big hospitals like the Regional Hospital and Next, Regional Hospital in Boya, Limbe, and even going to Douala and Yaoundé. This is a place within Kumba for all the people who need medical services, VIP medical laboratory checkup. I like how the francophone, they say bilan complete. It is strongly recommended that once a year, if you want to stay healthy, go for a medical checkup. We could diagnose certain diseases 5 to 10 years before they start manifesting. For example, hypertension, cardiovascular diseases, atherosclerosis, and even most of these cardiovascular diseases, even the diabetes, there are markers of diabetes. We could see that 5 to 10 years before it starts manifesting. So I challenge people who listen to this interview, they should make Ideal Medical Laboratory in Kumba their center. And I've worked in Douala, Yaoundé, Bamenda, Limbe before now, and I see that people like to go somewhere and do tests where they are not popular. And I urge people in the strongest terms, they should come to Kumba and do their tests. And I've been working here for 15 years, and I've passed through all the big hospitals in Cameroon, CHU, that's Accused, L'Hôpital Central, Bamenda Regional Hospital, Limbe Regional Hospital, even our Kumba Regional Hospital. And next year, I've passed through this area, and I don't want to be the one to be clapping for myself, but for the few people are making use of our services here in Kumba, they can give good testimonies.
How aware are the people of Kumba and beyond that there is such a facility at their disposal?
Okay, thank you so much. When we came to Kumba, other than seeing it as a very strategic business hub, we also saw there was a death in the health status of the town. So over the years, Ideal Medical Lab has been very, very consistent. We are the leading institution in teaching people about health conditions, infectious diseases that are very, very prominent here in Kumba. We sometimes gather statistics on the most prevalent infectious diseases. Then we go to the air, we teach people about these infections, how they can be acquired and how they can be prevented. And when it comes to health, I think a couple of days ago they were celebrating the International Day of Health, and it says, "My health, my right." If you are not adequately informed about your health, you can never be healthy. So information, medical information, becomes a tool, and Ideal Medical Laboratory puts this at the service of mankind here in Kumba, free of charge. We have programs, weekly programs over Lakeside Radio and even Ocean City Radio, and to a lesser extent Cabaret Good News Radio. So we employ all this media to make sure that people are adequately informed about their health, because when you are not informed, you will not be healthy. So it takes a lot of information to be healthy.
The way you talk, doctor, it looks like the public should not come here because it is free. Am I right?
Well, we give free consultation, we give free health information, but when it comes to certain tests, it cannot be free. For example, somebody wants to carry out what we call a general checkup to evaluate the internal organs like the heart, the kidneys, the liver. I think those are basic tests that there's always a cost. But what we really do is that we make our cost to be relatively low compared to other institutions within and out of Kumba. And we have a balance between the technical aspect and the machinery. All of that in Ideal Lab we have.
If you were to do an assessment of the impact that you had on the population, what would you say it is?
Okay, thank you. I will start with what we used to do here, a common test called culture and sensitivity. When we came to Kumba, people never know about culture and sensitivity. As we speak for now, at least 50% of the people in Kumba, they now understand what is culture and sensitivity testing. And testing to the common man, we do culture and sensitivity when there is a resistant infection of bacterial or any microbial origin. And when it gets to the point that bacteria too, they always fight back against the drugs that we have, they develop what we call microbiological resistance. Now, this resistance, it is a big problem. Let me take, for example, during the First World War, the Second World War, there was the discovery of penicillin. And doctors thought that they could use penicillin to wipe out every infection on the planet Earth. As we speak today, the Staphylococcus aureus that doesn't respond to penicillin again. So it is this culture and sensitivity testing that we need to isolate the causative agent. We then test with the available drugs to see which one is going to work. With that, we'll be able to target resistant infections. Otherwise, the patients in question would have died with such infections. We do have that stuff, methicillin resistant Staphylococcus here in Kumba. We also have the penicillin resistant Neisseria gonorrhea here in Kumba, not to talk about even tuberculosis. So it is thanks to this culture and sensitivity testing that we are able to target specific treatment for a particular bacterial infection. And this is very important, because if this is not done, very soon all the drugs that we have in our pharmacies will be useless. And as a matter of fact, amoxicillin and Bactrim, otherwise called cotrimoxazole, is no longer working in Kumba. So, and I will recommend to the forces that these drugs should be removed from the shelf completely in Kumba. Out of 15 years of culture and sensitivity testing, these drugs, they have never for once been resistant. So if patients take it, what happens? They only build up kidney diseases and liver diseases, because these drugs, they have a lot of side effects on the kidneys.